Hello, this is Dr. John Dang, Clinic Director and Doctor of Chiropractic at Columbia Integrated Health Center. Today, I am here to discuss the treatment modality of low-level laser therapy, otherwise known as cold laser therapy or low-intensity laser therapy. Laser therapy is the usage of energy contained in light to stimulate and modulate the function of our cells and tissues. When our cells become damaged, either through an acute injury or sprains, or undergo a chronic metabolic change such as arthritis or degeneration, inflammation sets in, which leads to a plethora of diminished and oftentimes inhibited cellular function. As a result, protein synthesis is reduced, which can cause altered metabolism and abnormal cellular processes. What does this basically mean? It means that when our cells are damaged or traumatized, they are unable to heal properly, which leads to scar tissue and inflammation of those cells. At Columbia Integrated Health Center, we use the BioFlex laser therapy unit, produced by Meditech International, a Canadian company with more than 20 years of clinical and research experience in the field of laser therapy. The treatment entails 3 steps to deliver the laser light. Steps 1 and 2 incorporate a red and infrared LED from a set of arrays that allows the light to diverge and absorb superficially and intermediate into the tissues. The 3rd step uses a laser probe that allows a more direct and penetrating beam to stimulate deep within the tissues. Here we have the BioFlex laser therapy unit. This is the main control unit, and this is a smaller handheld therapist unit. Attached to the larger unit, there's a computer that tracks patient progress and all the information necessary as we progress through treatment. Over here you can see we have the different arrays. There's a 750 array, the 1500 array, and of course the last step, which is the LDI 200 laser probe. I want to demonstrate what the laser light looks like. So on the 750 array, you can see all the super luminous diodes that are there. If I activate this, you can see the red that glows. We can see red because this is within the visible spectrum of light. From here, I'd like to demonstrate on a patient. I have the patient seated with their arm resting comfortably on a pillow. So this demonstration is for an elbow placement, assuming that she has an elbow condition. So we would slip her arm through there with the Velcro strap. I would place it so it's nice and comfortable and snug. Patient relaxes, and I would go ahead and activate the array. This runs for a certain period of time. When it's done, we then switch it over to the 1500 array. So I would take this off. Then we would apply the 1500 array over top of the same area, keeping in mind that this runs into the intermediate deeper layer. When this is done, we then switch over to the very last step, which is the laser probe. As you can see, the patient has safety goggles on. This is the step where everybody in the room, myself included, has to wear safety goggles to adhere to safety protocols. We would run the laser probe over top of the treatment area. This we would do to cover the entire area that's affected. When we're done with this, we remove the probe. Treatment times can vary, but will often last between 15 minutes and 40 minutes per session. The total number of treatments will vary depending on the patient's age, their condition, the severity of the condition, as well as how long they've had the injury. The treatment itself is very passive and gentle, and most patients will listen to music, they'll read, or sometimes just simply rest. There are almost no side effects associated with the treatment, and only a few contraindications to be aware of. Some of the conditions that laser therapy can assist with include muscle strains, ligament sprains of the knee, the ankle, and the wrist, tendinitis, cartilage damage, disc herniation and disc-related traumas, degeneration and arthritis, neck and low back pain, nerve impingement, as well as edema and swelling. Treatments are covered by most extended health benefits and no referral is necessary. If you're interested in this treatment approach or would like more information, please give our clinic a call. We would be happy to discuss if laser therapy is right for you. Thank you and see you next time.